discussing about the topic of diabetic retinopathy. Diabetic retinopathy and diabetes especially is a modern day pandemic, just like COVID. It hasn't been so abrupt in its arrival, it has arrived insidiously, and today every patient above the age of 35-40, you tend to ask the question whether he is on medication for diabetes or hypertension. It has become an all-pervasive thing in today's society, and diabetes is soon to become a major headache and a major concern in a country like India. We are supposed to become the diabetes capital of the world in the coming days. As an ophthalmologist, why is it important for me to talk about diabetes? People usually associate diabetes mellitus or the problem of diabetes with sugar, blood sugar. Raised blood sugar, uncontrolled blood sugar, this is diabetes. And they are prescribed medication and they are prescribed insulin as per their need. But from an ophthalmology perspective, it is very important to inform that diabetes can cause a lot of problems in your eyes. And these problems can vary from very easily curable ones if detected in the early stage to almost irretrievable situations if they go undetected and if there is a negligence on the part of the patient to seek medical help. Most importantly, we must understand that diabetes being a chronic disease, the treatment for diabetic eye disease too is a prolonged one. Now, what is diabetic retinopathy and what are the other complications of diabetes in the eye? You have to understand that there is a network of blood vessels within our eyes over the last layer of the eye, which is called the retina, the innermost layer, and that is where majority of the time there are hemorrhages and leakages. These lead to a condition known as diabetic retinopathy. Diabetic retinopathy thus denotes a disease condition of the retina where normal retinal tissue is often filled with fluid-like material or blood which has leaked out from leaking capillaries or blood vessels due to the phenomena of diabetes. Who develops these conditions? Diabetes is usually seen in two different subpopulations. One is someone who presents very early at a very young age. They are people who require insulin and they have a problem of not being able to produce the hormone insulin by themselves right from an early age. They are called insulin dependent diabetes. And there is another population above the age of 40-45, often associated with obesity. These people have the capacity to produce insulin, but probably their insulin is not working to the extent that it should in a normal person, and it's also termed as insulin resistance in some cases. And they are people who usually take medications and do not require insulin usually, but may require at an advanced stage. They are called non-insulin dependent diabetics. The most important association of diabetic retinopathy with diabetes is perhaps the duration. So you can well understand that for a person with an insulin dependent form of diabetes from a very early age would be more prone to developing an aggressive form of retinopathy within a few years of reaching adulthood or just after crossing adulthood. Whereas a non-insulin dependent person may have his vision preserved or his retina preserved till late in life. It has also been seen that diabetic retinopathy, being insidious in onset, may often be missed, and it is often first detected at the detection of diabetes mellitus. So it is very important to get your eyes checked up the very first time if you are first diagnosed with diabetes mellitus, because you may never know, you may also have concurrent eye disease. Thank you for now. We'll come with the next episode soon. Thank you.